Our project is entitled Clinical Research Mentorship Program. Our trainees call it CRMP. It's based on the premise that inequalities in research leads to inequalities in care. And especially in the developing country, because of the overwhelming demand on the clinicians, there is a shortage of availability to support trainees. Trainees are really motivated to learn how to do research, and we need to enable them and support them at the early stage when they're going through training. And the premise of the program is designed to address that gap. So what we did was design a program that really mimics what we do for our own trainees back home in person, but is all delivered virtually through international collaboration and through mentorship. It's a one-year program. We start off with inviting interested trainees to provide us with a research topic that they're interested in. And once we admit them into the program, they go through a 12-week research methods course, by which time, at the end of it, they should have refined their research project proposal so that it's ready for ethics submission and data collection. During the remainder of the year, between the trainee, the local supervisor, and the international mentor, they are supported to complete their project together with scheduled touch points as a group that the peers will meet with the supervisors and mentors together. By the end of the year, we expect that they will have completed their project and be able to present the data in an abstract form to international conference and be accepted and have the opportunity to present. Halfway through our program, we also build in a mentoring the mentor, because we recognize that mentorship skills is very variable, and it's a 6-week program that is evidence-based, that is designed to encourage conversation amongst the supervisors and the mentors to escalate the mentorship quality for our mentees. So we started this program, the first offering was in 2016. We also have the hypothesis that this triad that I just described will enable capacity building. But a secondary hypothesis is that by doing this program with different centers and different clinical environment, the organizers, us, will be able to do it better and be more efficacious and impactful with subsequent cohorts of learners. So the first cohort in 2016 was with Ghana, and after that we asked them to introduce to a colleague, and we worked with Zimbabwe. And then in the third group, we worked with Nigeria. Here having had 2 years of experience, they encouraged us to expand it, and here we work with all 7 training centers in Nigeria across the country. And in 2022, we collaborated with AORTIC and sent out the call for proposals across the AORTIC membership. And as a result, throughout the entire experience, we've now had 24 alumni across 14 centers across Africa that have graduated from the program. All of our trainees have completed their research project and presented in international conferences, with the exception of the Nigerian cohort where they were delayed by the COVID pandemic. We also, in our evaluation program, which is critical to success and improvement of this program, we build in surveys and qualitative interviews to measure the immediate impact as well as capture the long-term impact. In our qualitative studies, we were very happy to learn from our trainees that they were inspired by the experience, and through it they encouraged them to include clinical research into their career path. They also told us they were inspired to pass it forward. They want to be mentors themselves, so to mentor the next generation because they really valued the experience. In the mentoring the mentor sessions, we found that the mentors who participated felt that they have more knowledge about how to be a good mentor, although the metrics around what the mentees experience probably need longer term follow-up for us to see a difference. We also captured some of the experiences, career path of the early mentees, and we're happy to see that at least a couple of them have taken on additional fellowship training and has now become independent investigators, attracting grants, and also more importantly, starting programs in Africa that change the practice and impact patient care.